This is an introduction to the Caries Pracs, a series of 3 practical classes that we will undertake looking at caries risk assessment. Risk assessment is part of our care process for individual clients or patients. When we gather information from them at our initial patient encounter or first visit, we want to identify their current needs, but we also are interested in their potential oral health needs or their risk of developing disease in the future. All of this information helps us to create a care plan for our patients. Risk assessment is an important part of our care planning process because determining a person's risk helps us then to plan to avert disease or prevent disease, or if they have existing disease, to manage it, to prevent it from getting worse. So risk assessment is an important part of our thinking process and care planning process. So for each patient we need to record our assessment of their risk for 3 common oral diseases: dental caries, periodontal diseases, and oral cancers. The 3 pracs we're going to do are related to the first disease, dental caries. So when we think about risk really is the probability that some harmful or undesirable event is going to occur. And when we relate that to caries, it is the risk or probability of an individual developing carious lesions or existing carious lesions progressing on to cavitation over a specific period of time. So we're determining what the likelihood of a person developing carious lesion or a cavity in a particular time period is. That's what caries risk assessment does. It gives us a sense of what the likelihood of that undesirable outcome occurring is. And when we think about a person's risk levels, we need to take into consideration a number of factors. And each of these things helps us to determine their relative risk, high or low or medium or extreme risk. And we know that the caries process is dynamic, and it's influenced by both risk factors or risk indicators, and on the other side of the scale, the protective factors. And as long as the protective factors are in balance with the risk factors, we have no disease progression. However, if the risk factors outweigh the protective factors, then we will see disease manifesting and developing or progressing. So it's important when we're doing our risk assessment that we collect information in a systematic way about each of these factors. So disease indicators are clinical observations of the disease, in this case caries. So past evidence of caries, which might be a filled tooth, or it might be a missing tooth which has been extracted because of caries. And we're also, of course, interested in current disease. So any lesions that are untreated that we identify, as well as those that have been treated in the past. And we know that the best indicator or risk predictive factor for future disease is past disease. So it's important that we examine very carefully a person's mouth to determine disease indicators. We're also interested in the risk factors. So these are biological factors that will increase the risk of new lesions developing. So these are things like the plaque biofilm, the health of saliva, and also the dietary habits. They can be poor, and they push the ecological balance out of balance, and disease manifests and progresses. And these are the factors that we would target with our suggestions for things to do at home. And then there are the Caries protective factors. So these are therapeutic or biological factors that sit on the other side of the balance. So these are things like good saliva or healthy saliva, sealants that protect the tooth surface, antibacterials which affect the bad bacteria, fluoride which again strengthens the teeth against the insults of the biocorrosive products from bacteria, and diet which is either non-cariogenic or contains elements that promote remineralization of teeth. So we need to think about all of these factors. We also need to think about things like a person's social position, because we know that that influences a person's risk for disease, the health system characteristics. So these are all things that are more distal from the patient but have an influence. And then as we come closer to the individual, we've got these more proximal factors here. But what we need to do is collect evidence about all of these things in a systematic way so that we can then focus on developing the risk status. If we don't collect this information effectively from patients and make sense of it ourselves, then we're unable to effectively determine a person's risk status. So the collection of the data, which is what we're going to practice in these Prac classes, is really critical for you to get a precise risk status for your patients. What I'm presenting here is two graphs from the software Cariogram, which we're going to use in Prac 3, but they graphically represent a person's risk or actual chance of avoiding cavities. And we can see with patient A, they have a much lower chance, 18%, of avoiding new cavities. So the risk of cavities is quite high. In patient B, we can see a different profile. So here they have 44% risk of avoiding new cavities. So they're less at risk than patient A is. But we can see that within each of these two people, the factors that contribute to their risk, so in this case susceptibility, which is the saliva and the teeth themselves, bacteria, diet, and also other circumstances, and this includes their medical history, all contribute to this person's risk. We see the same factors here contributing to this person's risk also, but they contribute with different proportions. In this case, in person B, you can see that the saliva and the fluoride contribute less to the risk than they do for person A. So when you do a risk assessment, it's about developing an individual determination of not just a person's level of risk of developing disease, but also the different contributions that each of the risk factors make. So between two people, the contributions of the risk factors could contribute proportionally in a different way. If we look, for example, at these two people, you can see that they have the same chance of avoiding new cavities. So there's a 66% chance that they will develop new cavities over time. So both of them have the same risk level. However, you can see that the contribution or the factors that are related to their risk are quite different. In person B, their diet, so the type of food they're eating and also the frequency at which they're being exposed to cariogenic foods and drinks, the contribution of the diet here for person B is much greater than it is for this person here. It only contributes 5% to their risk. Whereas in fact, this person here, when we would be more concerned about the bacteria in their mouth and their saliva health than we would about what it is they're eating. Whereas with this person, we'd be more concerned about what it is they're eating. So you can see that if we give dietary advice to our patients, which is commonly what dental practitioners do, for this person, dietary advice would be quite appropriate because 1/4 of their risk appears to be related to diet. However, if we gave the same dietary advice to this person here, it wouldn't help them terribly much because their diet is not the risk factor that's contributing most to their risk. It's actually their saliva health and the level or type of bacteria in their mouth. So for this person, we'll be focusing on increasing the saliva health and also suppressing the bacteria. So you can see that taking the information from individuals and then determining the risk factor or the contribution of each of the factors is super important. So these 3 Prac classes are designed to allow you, as I say, to practice the taking of the information from a person, in this case it will be you or your partner, and then putting it all together. We're going to then create a risk status for yourself or your partner, and we're also going to identify the contribution of each of the risk factors for you as an individual. So that's what these 3 Prac classes are about. So these are things that a practicing dental practitioner would do with their patients in a single visit, but we're going to break it down to 3 Prac classes so that we can unpack and do things slowly so that you can take them on board much more easily. So the first Prac which we'll be doing will be testing the biocorrosive and corrosive potential of common foods and drinks. We'll then be looking at our saliva health, so we'll be testing various aspects of our saliva health and our plaque distribution and the relative quality of the plaque, so its maturity and its cariogenicity. And then in the final Prac, we'll be looking at some other factors related to risk and putting it all together and then plugging all of that information into the Cariogram software so that we can generate a Cariogram pie chart like this to demonstrate the level of risk and also the contribution for yourself. Excuse me. These Prac classes are not assessed, but you must complete them. And the way we will determine that you have completed them is we'll ask you to hand in at the end of the 3rd Prac all of your worksheets. All of the worksheets must be completed and must be handed in to indicate that you've completed the Prac class. If we don't have the worksheets, then you haven't completed the